Hi, I'm Natalie Roy. I'm the Executive Director of AgriState, and I just wanted to take a few minutes to introduce myself and our organization and hopefully get you acquainted with what we're about and why we were formed. In 2003, AgriState became a nonprofit because health professionals like yourself decided that they needed to come together and share resources instead of trying to work on their own in the agricultural community. So we've been around for almost 10 years. We started off in Iowa, and now we have membership in about 18 different states. And our membership consists of health professionals and researchers and educators who are striving to improve the delivery of occupational health care. So depending on which state you're in, you might be federally qualified health centers working to improve the health of farmers. You might be migrant health centers in North Carolina. So it will look different by each state, but there's a common thread, and that is that these health professionals recognize that farmers need access to good occupational health care. We're actually a virtual organization, which means that we don't have a physical office anywhere. We have health professionals and people like myself ready to assist you in different parts of the country. I'm actually residing in Louisiana and I work from here. You can see the topography is different. I always try not to talk to my friends in North Dakota in the dead of winter because this climate is not nearly as nice as it is here in the south. But I know that you all have taken a lot of effort to make it to the training and invest in the training that you're receiving this week. I commend you for that. I know it's not easy because you're leaving behind perhaps a clinical practice, but the training that you're receiving is going to be a wonderful investment, especially to your community, because you'll be able to be a champion for a cause that's not really well understood. AgriState is striving very hard to bring attention to the fact that farmers who work very hard for our country and work in extremely dangerous conditions are not getting good occupational health care. As you know, they often get misdiagnosed because the people caring for them don't understand the correlation between their risk and then perhaps an illness state. We need to change that because farmers are independent, they're on their own, they don't have human resource people to look out for them, but we need to have rural health professionals in local communities integrate what they've learned in training such as yours and to take that back to serve this population. Our organization, AgriState, we recognize that you can't just take the training and then have everything you need in that one training, that you need to have continued training. That's why we've invested in webinars that we offer. There's no charge to the webinars. Those are every month and they're on a variety of topics. Please make sure you get on that list to receive notification of the webinars. We also have clinical resources that we've developed for our membership, and those will range from things such as respirator selection screening form, to a complete occupational history form, to mass boards where you can have different particulate mass and the labels underneath. We have continued to develop resources based on what our members have told us. So, for example, we had our membership say, I don't have enough information to help me recommend the right respirator. As a result, we put together a very technical piece that's for the clinician to help them make good informed choices on respirator recommendations. Those are just a few examples of how we've tried to pool the resources of our organization to respond to the needs of our clinicians. Please think about joining our organization. We need your involvement just as much as you may benefit from us. We need you because we need people to stand behind this cause and to help make it clear that farmers need access to good health care. They need it from the right person at the right time, and they need to know that there are people like you working to make that happen. Hopefully we have one voice. That's why we have AgriState in different parts of the country. We have state affiliates. We're very pleased that North Dakota has come on as a state affiliate. In terms of the champions in your state, they've done a tremendous job putting on this training. University of North Dakota has worked very hard for this. Iowa Center for Agricultural Safety and Health, the University of Iowa, I know is a strong supporter and also is part of the actual instruction. Lake Region State College has done a fabulous job in pulling resources, and Southwest Area Health Education Center has sponsored many of you to actually be there at the training this week. So without that group support, you wouldn't have had the training opportunity that you have today. We hope that it will continue in the future, and that perhaps you can get your colleagues next year or whenever it may be offered to attend a training. In closing, I just want to tell you, because I know you have very interesting things to hear about, that again, we're here for you. Make sure you access our information. It's not easy to do this. We know that you're not just working perhaps in agricultural health. You don't have the luxury to work with one particular population. But when you do have an opportunity to integrate what you've learned, I think you'll find that the results are going to be amazing. You're going to reach farmers in ways they've never been reached before. So thank you for investing in the training this week, and I hope we could be of assistance to you. Again, my name is Natalie Roy, Executive Director of AgriState. Take care.